Hello, I'm Dr. Graham Kurji, York Region's Medical Officer of Health. We are now in a modified stage 2, largely because we want to prevent the transmission of disease where people gather and where mask use may be non-existent or limited. So, with the restrictions on indoor dining, with gyms and fitness centers being closed, casinos, bingo halls being closed, and additional restrictions put on visitations in long-term care homes, we hope to be able to get our numbers down again. However, there are many other areas that do get affected in a modified stage 2, and we urge you to visit our website at york.ca/COVID-19. As our cases have been going up, averaging at over 80 per day now, the numbers of outbreaks is high, currently at around 45. It is particularly important that we double our efforts at getting back to the very low numbers that we used to have in mid-August. It can be done, but it requires efforts on each and every one of our parts. Unfortunately, governments cannot always legislate these things. So we need to go back to the basics. Keep a physical distance of 2 meters or more from anyone other than your own household. Make sure that you're wearing a mask if you cannot keep those physical distances. Ensure that you're washing your hands frequently. Stay home if you've got even mild symptoms. And make sure you get the flu shot as soon as you can get that. Also, download the COVID-19 app so that you're warned if you've been in close contact with someone with COVID-19. And of course, seek out testing if you have symptoms of COVID-19 or you've been in contact with a case of COVID-19. It is particularly important that we redouble our efforts. We can make sure that the numbers come down. We did it once, but this time there are many headwinds blowing against us. Respiratory outbreaks have increased, and influenza season is round the corner. As the cold season comes in, we're going to be pushed indoors. So avoid any crowded gatherings. If there are any such places, extract yourselves. It's important that all of us play a role here in bringing down the numbers involved. Remember this, how we get these cases are somebody acquires this from a place we don't know whether it's through shopping, whether it's through dining, and then they bring it into the home and they transmit it to their children and they transmit it to their spouses, and it makes its way into the schools, it makes its way into long-term care homes. The flu season is round the corner, and we urge everyone to get a flu shot. It is important that we reduce the flu-related morbidity in the hospitals so that we create capacity for COVID-19 patients. Also, flu symptoms can be confused with COVID-19 symptoms, and we do not want to overburden the testing system, as we need to retain our capacities for COVID-19. Besides, flu itself carries quite a high morbidity and takes several lives in York Region every year. I'd like to also say that when you hear about our school outbreaks, these are instances where we've had 2 or more cases within a 14-day period where we think the transmission might have occurred in the schools. We work closely with the schools, and we may dismiss cohorts. In some cases, we have to close the schools temporarily. There are many layers of protection that have been built in for our children to be kept safe. However, there are things that we cannot control all that well. Unfortunately, many school children seem to be intermingling in municipal playgrounds after school. This has to be restricted and stopped. We have to do our part to keep the numbers down and to keep our children safe. Thank you. Be vigilant and be safe. Thanks.